you please talk about how PAH affects remodeling of the heart and major vessels?
Absolutely. So, when we're talking about the changes that occur because of PAH, the first place that I always start is the blood vessels of the lungs. These are called the pulmonary arteries, and they're those blood vessels that run from the right side of the heart, the right ventricle, out into the lungs. We would think of these as not just major blood vessels, but they branch into millions of tiny little branches of blood vessels that come off those larger ones. And in PAH, what you start to see is that the blood vessels start to not function in a normal way. And many different things can trigger that abnormal functioning. And what ends up happening is that the blood vessels start to constrict or narrow. So now you have millions of blood vessels that used to be larger, more open. Blood could easily flow through them. And now those blood vessels have become more narrowed and constricted. So trying to get the same amount of blood through more narrow tubes obviously becomes more difficult. So that's how the blood vessels start to change. There's also some of the changes in terms of thickening of the blood vessels. So you now not only have the blood vessel becoming more narrowed and constricting, but you also have the inside of the blood vessel becoming thickened. So once again, further narrowing that blood vessel. So that's some of the changes and remodeling of the blood vessels that we see. And it's those changes within the blood vessels that then causes the changes to the right side of the heart, because the right side of the heart is working to push that blood through the blood vessels. As the resistance in those blood vessels goes up because they're more narrowed, the heart, being a muscle, has to work harder, has to squeeze harder, it has to pump harder, it may have to pump faster. And over time, that becomes exhausting for the right side of the heart. The muscle at first may get thicker and bigger, and then over time, the chamber of the heart actually starts to dilate and enlarge. And once that chamber is larger, it's harder to squeeze as well. And so getting blood through those blood vessels becomes that much more difficult.